Welcome to Healthcare Blind Spots. I'm Vivian Kopsinter-Birchall, your host, and I have a special team of guests here who are nurses in Uganda who are here to share their experiences as nurses working on the continent of Africa, to be precise, in Uganda, some of their challenges, experiences, and thoughts on how to improve nursing. But to start, I'd like to welcome our guests, and I will call on each of them as they appear on my screen to in just 1 minute, tell us about yourself, and then we'll pick it up from there, starting with Violet.
Yes, my name is Violet. I'm a registered nurse working from Wakiso currently.
Thank you.
Nice to meet you. And I'm so happy for the privilege given us to Uganda.
Thank you. Alex, you're next.
Oh, hi everyone. I'm happy to be here. My name is Alex Ainembabazi. Right now I'm in Kampala, but originally I come from Barara. I'm a registered nurse, but currently I am a health advocate, specifically sexual and reproductive health advocate. I currently work with one of the organizations in Kampala. Yeah, basically that's me, like in 1 minute. Yeah.
Thank you. Arthur?
Hello, good evening. I'm Song Arthur, a bachelor degree in Barara University, as well as a diploma in nursing, nursing. I've worked with various organizations, and of recent, working with a hospital called Emergency Hospital in Tere as one of the team members, as well as the Director and CEO of St. Jude Medical Clinics in Entebbe. I'm glad to be here and share experience with my colleagues. Thank you.
Thank you, Arthur. You were also a bit not audible, but we heard that at least you work, you're a nurse. You're now in Entebbe in a hospital. So we'll pick up more of that as we get along. So next is Anthony.
I'm Anthony Mujulizi. I'm a registered nurse. I come from Ruchiga district, that is Kabale, Greater Kabale. I did my comprehensive nursing from Kisi's Hospital, Rukunjiri district. I also did diploma from KIU, Kampala International University, Western Campus. Currently, I have worked with several organizations, including Diocese of Kigezi, Rugarama Hospital, but currently I'm working with Kalangala District Local Government as a nurse. And where I work basically is the farthest island within the district. And that is where I am. If I'm to do the background video, you just see water. But I'm happy to serve as a nurse. And I'm grateful to hear from you, Vivian. You are my neighbor. Yes, so that is it. And I think we shall share more later.
Absolutely. Innocent?
Thank you.
Hi everyone. I'm called Chirunda Umaro. I'm enrolled in nurse by program. I'm currently working as the. Am I clear? I'm currently working as the head of medical department, Barra State Football Club. A team plays in the Uganda Super League. Yeah, I think that's all about me.
Wow, fantastic. So we've heard from all of you. There's a wide range of experiences and backgrounds. We have somebody in sports medicine, somebody in reproductive health, someone in local government, and Violet, I don't remember whether, do you have a specialty?
Yes, I'm a nurse, but currently I'm working with the Laga Hospital and Pharmacy. That is why I'm seated in a pharmacy right now.
Well, yeah, that's great. And so we have these various categories of where you work and what you do. I guess my first question would be, what is it about nursing that you love? If you, in 1 minute, each of you can share what you love about your job or what drew you to the profession of nursing. And I'll start with Alex because I see you on the screen. Violet disappeared.
Yes, thank you so much. One of the things I love about nursing is you get to interact with people. I think when I used to be so much of an introvert, but the profession has opened me up in one or another. But you get to understand how people understand life and what they're going through. It is easier to share that information with you as a nurse if you're closer to them than someone who just comes in and checks the medical records and goes and what have you. So yeah, it's one of the things I love about it.
All right, we'll just skip and go to Anthony. What do you love about nursing?
To be specific, what I love about nursing is the aspiration that I had from the nursing. When I was growing up, when I was still a child, it is this kind of scenario that happened. I didn't even knew the career I will pursue. But I changed my mind when I visited X's Hospital as a child when I was sick. And the questions that were asked about me when I was still a child, that information gave me hope that at least I need to be like these people. The way they were smart, the way they were doing things, the way they were successful. Remember, that is a local setting, and we used to look at them as people who have made it to reach somewhere. So I got inspired by the way they were doing, and since when I was a child, I was taken care of. I grew up with my grandparents, so I used to take care of them, doing nursing them when I was at home. It also the things I was doing at home, they were the things that that were done in a hospital. So I was like, no, I can make it, and I can be even better than these people since I have been doing it since childhood. So that's where my journey started. And the more bit of it that I love is when you serve without boundaries, it shows me that it fulfills my life, that is what I'm intended to do in life.
Thank you, thank you.
So basically that one changed me, and I like it about nursing that it is the kind of profession whereby you give in your skills. Okay, thank you.
Thank you. Innocent?
Okay, like first and foremost, what I love about nursing, I love about it being like a calling from God. Because why I call it a calling from God. At first, I never wanted like to take on nursing career, but I think it looked for me in all means. Because I had even joined HSC, but after COVID, I decided to go on for nursing. At first, I never loved what they call nursing, because even going to school, like it was a tug of war. But for real, it's a calling. As of now, I don't regret to take on my nursing career, because some of the things I love is like the inspiring patient stories. Like these patients, when you give them time and try to converse with them, for real, these patients have great stories. You get, and they have helped me to develop. They have helped me to grow up, for real. Another thing I love about nursing is the collaboration and teamwork at the workplaces. For real, nurses are really collaborative and they really have a great teamwork. It's always it is on rare occasions to find nurses fighting. It is on rare occasions to find nurses quarreling. What? So those are the 2 points I love about nursing. Thank you so much.
Thank you. Violet, and then Arthur.
I love nursing, first of all, because it's the backbone of medicine. That's what I can say, first of all. Secondly, what I love about nursing is it has helped me to build my self-esteem. I couldn't stand in people like and talk and express myself, but after doing the nursing course, doing those health talks when you go to communities, when you go to health centers and so on placements, it really built my self-esteem. Now I can stand in a multitude of people and I speak and I tell them what I want to tell them. So I love it because it has built my self-esteem. Secondly, I love it when I see that I'm putting someone's life right, physically, emotionally, and spiritually, even mentally, you understand? So it feels so great for someone to come and tell you that, so I'm very okay now. Thank you so much for taking care of me. Thank you so much for everything. It feels really good. It feels really good. So that is why I love dancing. Those are the things I love about it so far. Thank you.
Thank you. Arthur, you are.
Okay, as I said, Sonko, a bachelor holder nurse, and as well as a diploma holder. So what I love about nursing, actually this one I would highly recommend if possible, all the listeners and others watching this video and listening to us. If possible, really, all nurses and midwives should at least be having the bachelor's degree. Reason, when we go for the diploma, some things are left out because they think nurses are just helpers of doctors, which is not right. When we go even for bachelor's degree and stuff, you realize that a nurse you can stand on your point and be on yourself and defend yourself and defend the point if at all it is right. Gone are the days when nurses were seen as helpers for doctors, where the doctor could be just remove gloves and give the nurse this kind of. Gone are the days when you used to see nurses as the ones who are pulling the trolleys, pushing the trolleys for the doctor. So these days things have changed. We have to everything you do as a nurse, you must have a rationale or why you are doing that. So it is, I'm happy that nursing in Uganda it is changing the formula and it is taking up space for the health facilities because nurses are the backbone, as someone has said earlier. Without a nurse, patients do not get treatment. We have to check their vitals, to check their vitals. So this one has greatly improved the nursing profession, whereby most of us are now in the facilities just because it is by passion and because it is a calling. So all of this is it's really nothing is a calling and it is passion. Whatever we do, we have to do it with passion.
Thank you, Arthur. I mean, this is a great segue into the question I had, which was next. It's divine intervention that you've introduced the whole conversation around. Nurses are not only helpers to doctors. My question was, or is, what are some of the things that nurses do that doctors or the hospitals cannot do without?
Yes. Will you please repeat the question?
So what is the one thing that nurses do that doctors cannot do without? Like if the nurse is not there, the doctor will be disorganized, the hospital system will break down.
No, one of the things, actually there are very many things. There are very many things. Just like Violet said, nursing is the backbone of medicine. There are a number of things that doctors cannot do. Me, I've got an experience. There was a time I was working in one of the hospitals, KRU, and by then I was working as an intern nurse. But you come to realize that a number of doctors don't even know how to put an IV line. Like it may look like a shock, but it is the fact. They cannot put an IV line, they cannot put an NG tube, they cannot put a catheter. Like some of these things look as if they are simple and you expect a person to be able to know them, but they don't. But how are you going to administer a drug when you don't have an IV line? Like some drugs are so much helpful through the IV line. So apart from that, there is, you know, when it comes to the drug administering and what have you, and then documentation, the first thing that these doctors look at when they come to the patient's file, if you have given the drug, they want to know, did this person get the drug? So they're checking your documentation. So assuming a nurse is not there, and honestly speaking, me, I've seen it in these hospitals that I've worked in, as some of them, someone will give a drug that some doctors where they'd be like, oh, this nurse has delay, let me just give the drug. So they give the drug and they fail to document. So you come to give a drug and you're not sure if they actually did what? administered it. So one of the things is that those procedures that may look very simple and you expect everyone to be knowing, but they don't. So if they're not there, how the hospital cannot run, honestly. Yeah.
Thank you, thank you.
Yes, the first thing I can talk about, doctors can't do without nurses. For example, for us nurses, we are always on the ward monitoring our patients. So if the doctor is on the ward round and they come and they start seeing the patients, reviewing the patients and start asking, how has this patient been? What are the vitals? When the nurse was not around, probably this doctor will not get the vital information about this patient. Because even if they try to do objective data, still it will need a person has been with this patient medically to explain how this patient has been. Is there any improvement or not? That is the first thing I can say. Doctors can't do without nurses. The second point I can talk about is here when these doctors are going to do procedures which need sterility. We, the nurses, are the ones who prepare. Trust me, most of the doctors don't know how to prepare a sterile trolley. They don't know. So if you're not there to help them out, they are going to end up doing procedures which are not sterile. And trust me, patients will end up getting sepsis. So it will need a nurse to prepare very well a sterile trolley for the doctor to perform that procedure and then help them still, because they can't do the procedure alone. Still, you have to be a helper. Give them what they are not supposed to cross the sterile environment, the one which is not sterile, sort of that. So nurses are very vital. Doctors can't do without them. Those are my few points I can talk about. Thank you.
I like this whole recurring theme of the vitality or how vital nurses are. Full disclosure, I forgot to mention it at the start. I have a soft heart for nurses because my mother is a nurse. She was a nurse, trained in Kabari. So, although she's a Muganda who left Uganda, went to train in Kabari, that's how I came into existence. So when you mention all these things, how vital nurses are, one of the reasons I really wanted to provide a space for nurses is because I realize how undervalued nurses are, and it's really unacceptable. And I want to play my little part that I can to change that narrative, to change that the way the health system works, and provide more value to nurses that is deserved. Anyway, with that Kalango, next to we'll have Anthony.
Okay, thank you very much. That is a good question. As my colleagues have brought it, nursing is the career of medicine. First of all, the things nurses do, doctors can't manage to do with them. First of all, we look at patient education throughout the journey, like when someone is admitted, by the time someone is discharged. The roles nurses play, it is this kind of relationship that is one-on-one. You get to know even deeper beyond the just disease. You even create a bond, whereby you can even look at the facial expression in the morning, in the evening. But doctors always surface at the time of prescription and ward rounds. But the more time and the healing time that is too critical is just is experienced by nurses, and they are the ones who take care of these patients throughout the journey. And sometimes we even realize that healing doesn't even need this prescribed medicine, but the way reassurance that is done, it is always done by nurses. And in patient teachings, in advocacy for good health, these roles are done by nurses, not doctors. Then there is also what we call the continuous monitoring. For example, after like a surgery, it is nurses that take role on monitoring of all the things that happens, side effects of medications, how the wounds will be healing. It is just the role of nurses. Even if the doctors come on the ward round, still they will be asking what happened when we are not around. That means the whole hours with the patient are spent with the nurse, not with doctors. emotional and psychological support that is provided by nurses, that is a routine care that is provided by nurses and midwives, which we don't find with medical doctors as well. Then we also have the administration roles. When you look at the hospital structures, most of the departments are headed by nurses. So the management critical areas that are really needed in the hospital, those roles are taken up by nurses, and they are the ones who are doing them, not the medical doctors. So basically, that is what I can describe within this time.
Yeah, thank you. Arthur, then Innocent.
The first thing I'll talk about innovative solutions. Innovative solutions, because you find out that in Uganda, we have a gap in resources. You get, whereby these doctors are not so innovative that they will find a way, like, or find a solution to something which is not around. When something is not around in the hospital, the doctor will be directed that this is not around. But for the nurse, at least he or she will find a means of at least covering that gap. Yeah. So that is one of the things nurses can do and doctors can't do. Another thing, adaptability. Adaptability. When I talk about adaptability, it is like adaptability on the challenges. You know, in Uganda, we are facing a lot of challenges as medics. You will find that these doctors are not able to adapt to these challenges, not as in nurses. For nurses, for them, they easily do adapt to these challenges than the doctors. Yeah. Another thing that I will talk about, it is maintaining that relationship between the medic and the patient. It is on rare occasions to find a doctor maintaining that relationship between him and a patient, him or her and a patient. You will barely find that always these nurses always have a tendency of winning these patients' love more than the doctor. You'll find out, Munanga, God call for me, Musaugu is the one who will work on me. You get, because of that relationship between the nurse and the patient. Yeah, I think those are my views, Madam Vivian.
Thank you. Arthur, finally? And Arthur said he's on duty, so in case he's not available, we'll just move on to the next question, which is something that I think I've seen from all of you when I asked the question, what are some of the things that you'd like to see improved? The overwhelming response was, can you guess? Low pay and poor remuneration. So my question is, why is it, what would you like to recommend that people who are in charge of paying nurses do? And, you can, while you answer that, you can share any thoughts in that line that you may have in about a minute or two. I will start with Alex.
Thank you so much. You see, when you talk about payment, it is, I've ever had a discussion, I think I've had a discussion with someone about the same thing. When you come to realize, I'm a bachelor nurse, but you may count the number of bachelor nurses in hospitals right now. Honestly speaking, if you move around. Reason being, the money paid is really little, truth be told, considering the amount of work being done. Because just like we talked about it, a nurse is going to be there from morning, let's say the shift is for 12 hours. You're going to be there from 8 to, in the evening. And then the doctor comes in, writes, looks at the patient, prescribes, and goes. And the amount of money they are getting is far way much better than what you're getting. You're there for more hours. You have a family, you have kids to take care of, and you don't even give them time. So honestly speaking, the money that they're giving the nurses is, I don't even know what to call it. I don't know how I should say it is below the minimum wage or what, but it is really little. So for the people who are really doing the payments, they need to look into it. But I think, I don't know if it is the problem, but this is where I think the problem could be. When you look at the people who are in charge of, let's say, these payments, or the people who are heading the whole medicine thing, they are doctors. They are not nurses. You may find the number of nurses on that, the committee, if that is, if they're even there, I highly doubt if they're even there. They are really few. So if there are 10 people and the nurse is one, the voice of that one nurse is not big enough to defend the rest of the nurses. So most probably, if we could have more nurses on the committee to fight for the nurses behind, it would make much more sense. Yeah, my views.
Thank you. That's fantastic. Violet?
Thank you so much on this. I even don't know where to start, but trust me, the money which is being paid to nurses compared to the work they do is totally low, very less, very less. Because my point of view is that the people who are put in human resource are not medical workers. They are not medical workers like the top human resource managers. So they don't know what work we do and what we pass through. And we end up being quizzed in that way. And people think that we nurses, the work we do is not worthy what we are supposed to get. Some people have that point of view. So they end up like giving us what they wish they can give. For this one, majorly, it is for both government and private sectors. For organizations, I can't tell. I've never worked with an organization, but I've ever witnessed my colleagues who are in government. They're also crying. You understand? Compared to the work they do, you are going to reach on ward, whereby on ward you're having 400 patients to work on. Or let me say, OPD, outpatient department, is waiting for you. They are like 200 are going to come to be worked on that day. On ward, a nurse is on a surgical ward, but the surgical ward, there is wound dressing, of which every wound is in its condition. That a wound, clean wounds, you have to dress a wound for like 3 hours. You're having 30 patients on ward. And you have to finish that within that time which is given to you for your shift. So if your shift finds you when you are not done, you're supposed to prolong your shift so that you get done with your work and hand over fully. Now, and there is no time, overtime payment which is given for that work you've done, or for those hours which you proceeded with to finish your work. So you end up being, what can I say? Is it burnout? You end up in a burnout state, and you end up feeling like, I'm not worthy. Maybe I was not supposed to be a nurse. Like, you end up asking yourself questions. The money is totally little. That is it. So what I advise our human resource managers to help us, they have to sit down with those people who understand medicine very well, who understand nursing very well. They collaborate with very well, sit on the same table and really talk for us because we don't have a voice. Honestly, we don't have a voice there. And trust me, we are the ones who do a very great work in the health ministry.
We'll get back to her later. I think in the meantime, Anthony, could we pick it up from there, please?
Okay, thank you very much once again. When we talk about the challenges that we face within the medical setup as nurses, basically some of them are based on policy. The policies that govern nursing basically are done by people who are not even nurses. So surely in Uganda, we cannot imagine that nursing career will grow when we have people who make policies that are even biased. For example, when you look at the curriculum for nurses, really at the level where we are, we could be expecting that we have nurses who have reached the level of PhD who can influence us, but still in the government, they are not given positions. So there is no way how someone is going to implement something that he doesn't know. Another thing is regarding the implementations. When you look at the administrative structures within, like, for example, Ministry of Health, we have few nurses who can advocate for the nurses, and basically the most challenges come from that. And for example, for us who are working in local government, for example, like us who are in Kalangala is a water-based island, meaning the challenges we have may be unique from other districts like in Uganda, but still you are paid the same money with someone who works at Ministry of Health headquarters just sleeping in Nakasero. But here they don't know that for you to travel to Kampala, you spend 3 days, even a week without reaching there or not even getting means. And so it becomes that challenge that nursing career cannot grow. For example, when you are in a setting that it doesn't have access, even upgrading becomes a challenge. And upgrading comes with having new techniques, having new skills, even advocating for nursing career just beyond what you just see on the ground. Then another thing is the financial capacities. When people have talked about the raw pay, I may not repeat that because for it is the order of the day. When you look at the inflation that comes in, it hits us all. But for those people who are implementers of policies, for them, they can just increase their salaries, but they don't think that nurses are the majority and they still have the same challenges with everyone around them. And still, nurses and midwives are looked at as a unique body, but people don't know basically the services they are supposed to offer, and they want just to use them for political gains. So that one becomes a real big challenge. And when you even look at the bodies that govern nursing, for example, like Nurses Union, it is us nurses who look for the council, not the council that looks for us to even know the conditions where we work from. So it becomes a challenge. You just rule people, you don't know what is going on in the ground, you don't know the working conditions, but you just wait for them when their licenses have expired. You just wait for them to come and look for you, just help them in renewal. So there is a policy shift that is need to be rectified and be improved to meet the standards. And for example, like when we talk about like globalization, at this level, Uganda could be even copying the curriculum from the US and implement it because we are serving the entire population, but you realize that we are still lagging behind. If this certificate should be improved at a rate where we can compete globally and have the same skills with those ones who are working in the first world, because medicine doesn't know the first world and the third world. We are the same, we are providing the same services. So basically that is one of the challenges. Leadership is the biggest challenge. And when we talk about money, so when someone is biased, really cannot do anything better than because they are just thinking about fulfilling their needs. So basically that is it. Thank you much. Thank you very much.
Thank you. You all bring up important points that I will get back to, but Arthur is finally here. Arthur, there are two things I would like to request from you. One, to talk about what we're talking about right now, which is the pay gap for nurses. And the one before that, what is the one, some of the roles that nurses do that doctors cannot do without? And so the two in one, very quickly summarize those two, and we'll go to the next question.
Thank you very much. My apologies. My network is always up and down.
No worries.
But hope I'm audible now. Am I audible now? Okay, thank you. So those roles the nurse can do that doctors can't do, really they are quite very many. We can talk about the investigations which we take off, the vitals which we always do, like maybe every after 30 minutes, every after an hour. So all those investigations are really crucial, like for us nurses, which they can really give us something like maybe can give us from the patient, whether the patient is improving or something is not right. So for the nurses, that is a special thing which we do as nurses that doctors may not do. Maybe they have missed this one. We may find a nurse who can even be perfect in some nursing procedure. I think that's why even doctors, dentists, and all other medical personnel, during their first year of study, they always have that nursing procedure or nursing something which they study in their school. So it means there are some procedures, nursing procedures, which have to be learned and which we do, but doctors don't do, like cannulation, oxygen administration, those simple procedures which for us nurses, after getting used to them, we think it is.
I think we lost Arthur.
Yeah, now for me, for the playing up, I'll talk on my level because now you will find out that a nurse is subjected to long working hours. I think most of them are disenrolled nurses or certificate level that will find he or she working like from morning till around 10 p.m. till around 1. But at the end of it all, you find this nurse earning 150, 200, 300, and there are no other benefits, making it hard for them, I think, to cater of themselves and their families. Ending up, I think, working, I think, for food, maybe, and other small things. You get my point. So there is a big payment gap in Uganda. So I don't know if there is a way like this government of ours can sit down, I think, and put up a salary structure for these private facilities. Because I think these private facilities, most of them are taking an advantage of nurses being many, and I think being in the zeal of yearning, zeal of work. Because you will find out that they will put up an advert and it end up like over 10 nurses have called like to occupy that job, meaning that even these bosses now, they take an advantage. Because even if you to go there and tell this boss, now you're not giving me my money in time, what? He will tell you that even if you go to there, I will find another nurse. So I think the government has not yet helped us out about that issue of low salaries. And even I think our body, like the Uganda Nurses and Midwives Council, I think they also have to sit down and implement some structures to find a solution for this challenge, because I think it is the biggest challenge nurses are finding in Uganda. You find someone overworking, because actually I ended up even I think this saying I think they brought it up for us nurses, whereby they say that people who are subjected like to overwork load, they earn less than people who are subject like these people who work smart, like for them they work for few hours. What you'll end up, these guys are earning more than the nurses who are overworking. That's like an example of why it was Alex who said that a doctor will come and work for 2 hours, and a nurse who is working for a day, you end up seeing a doctor being paid 3 times more than this enrolled nurse. So I think even our body has not done much to help us out. So I think before even going for a government, it will start by our body. Because if our body sits down and finds solution, I think nurses would have been facing such get, and even putting up some benefits for us nurses. Because you will find out nurses are there working out, but there are no other benefits. If it is salary, that is salary. You have to wait. There are no allowances. There are no what. Even allowances, they announce in advert that we shall give you accommodation. We shall give you like meals. They for the meals, you will gain a facility and they will be giving you, I think, let me say 5,000. But Madam Vivian, 5,000, why I'm calling it right, or it is Vian. Okay, let me use the other one of Kobsinje. Madam Kobsinje and our dear listeners, just imagine someone giving you 5K to get for the whole day. You have to eat breakfast, you have to eat lunch, you have to eat supper. Just imagine such a situation. So you will end up like the money working for all of it. I think you'll be using it just catering for yourself, whereby there is none other thing you'll be. So I think our body has to work much hand in hand with the government to find out the solution for this challenge.
Well, thank you all. This was very insightful. Not surprising though, given how many of you responded that way in the emails. And I hope that this will serve as a voice being, I hope people in decision-making places can listen to this, please, and recommendations. And then there is a lot that I want to follow up, but I'm trying to not make this very long. But it's also an opportunity to bring you back next time for a part 2, because I want to try to keep it under an hour, because people's attention span is not much. But again, all of you have shared very touching and very critical issues in nursing and nursing welfare, and that we should be all paying attention to. But so my last question as we wrap this up is, what are some, if you were to recommend, actually there are two. I'm going to put two in one. One, if there are people like us who are not exactly in the Ugandan healthcare system, but we want to be partners with the healthcare system, how best can we do this? And then two, what are some of the recommendations you have, so the Ministry of Health or global health organizations, in how they can support nurses? I'll start with Alex. Oh, Alex is off. I will start with Violet.
Okay, yes. How these people who are not health workers can work or partner with us.
I know. I said those who are not working in the Ugandan system, but
Pardon?
haven't, those who are not working with the Ugandan health system. For example, I am in the United States. I'm not working with the Ugandan health, Ministry of Health or the health system. But we are many diaspora, for example, and many organizations that would want to partner with the Ugandan healthcare workers and the healthcare system. Thanks for that.
Yes. Number one, I would say these people should start an organization, a health organization, specifically to partner with what? With the government to help the health sector. Though we've seen organizations coming in and partnering with the government, but still things are confused from there, and the help does not reach us.
That's my concern. That's my worry. So how can we make sure that the help meets the people that actually need it?
I don't. What I can say is that here we need these organizations to strengthen their collaboration so much, and to make sure that what they are doing or the help they are extending towards us and the people who are receiving health care services is reached out to them, to follow up. In simple terms, I can talk about follow up and evaluating whether what they delivered or whether what they are doing is effective. Because at times they can think they are helping, but when what they are helping or what they are delivering to us, we are really not even aware of what is happening. I'm seeing many organizations in the health sector, but most of them even don't know what they do, trust me, but I'm in the health sector. So following up and evaluating what has really been done by these specific organizations, not the government, and to make sure that they collaborate well with the government and they see whether what they are doing is really effective. That is my first concern, or that is the solution I can give us for now. Then another thing I can talk about is that since we have the body of the council, nurses council, we have the nurses and midwives council, it is just they are waiting for us to go give them money. Every day they are adding on money, which we don't know where it comes from. So it is good for the organizations, or for you, Mrs. Vivian, you go and collaborate with them, because for it is not too large, it is somehow limited. So if you collaborate with it, and we are specifically nurses who go there for the help, who go there to see that we are helped, yeah? But when they are not collaborating with the whole government, but specifically through that organization, it will help us. Then another thing I can talk about is that if they can formulate a body specifically for health workers, specifically for the affairs of the workers who are working in the working sector, it can also help. Because we see that if people come from outside there, from Canada, from US, from Massachusetts, and they want to really collaborate with these nurses, they will know which people to approach, which bodies to approach, you understand? Not to go to the Ministry of Health, but they will know that here we want to collaborate with the nurses. We want to collaborate with the doctors. Which body can we go to? Which body can we collaborate with to see that we meet these nurses nationwide? Yeah. Thank you so much. Then I have the question. What was it saying?
No, that's okay. I think you've covered. It was what are some of the recommendations to help with nurses in Uganda? Something that the government.
Okay, thank you.
Yeah. Right. So after I'll get back to you, but first let's go to Alex. I had called on you before. What are your thoughts?
Thank you so much. First of all, let me first make a comment. Sorry, Violet. But let me first make a comment on what you said. You see, when you're helping, I don't know whether I should call it even helping, but when you want to come up with a solution or when you want to be better, you have to begin with yourself before even another person comes in. I think the biggest challenge we have in here is from within. I would first say that from our own Ministry of Health, from our own body of nurses and what have you. Because even if the people come from out and they want to help us, the nurses, they reach the Ministry of Health and the people in the Ministry of Health are not nurses. They're not going to help us at the end of the day. So one of the recommendations I would put out is let there be nurses when it comes to these committees, because who is going to decide for a nurse yet you are not a nurse? What decision are you making? It does not make sense. So let them allow nurses to be on the committee to make decisions for the nurses. And then after making one clear and everything is settled, the outside organizations can come in and make the collaboration because already they know where the problem is. The fact that I am a nurse and I've been in the field, I might have seen this and this and this is happening. Another challenge that we may be having is the people who are currently in these positions are not in the hospitals. They don't know exactly what is happening there. You get? So if I'm seated there in office and then I don't know that nurses don't eat lunch, how am I going to help you? Still, it does not make sense. So it needs people who are actually in the hospitals to be able to help. Just because you are in the council, it does not mean you're supposed to sit there and wait for people to bring their licenses that have expired and you just renew them. You need to know what is back in the ground. So I think for me it would be, it would need us to first work on ourselves as the internal, as Uganda, as the Ministry of Health, and then the outside people can also add in. Yeah.
Thank you. Arthur, your hand has been up. Your turn.
Thank you very much. My sincere apologies, my network is not the best. So my concern is on the unions and organizations which can help nurses. The biggest challenge we have right now in the country, as one of the colleagues has said, decision makers, some of the decision makers, you will find that nurses are not among probably, or if they are there, they are very few and they only think about themselves. Do you realize it in these offices which we have?
Yeah, your network is off again. Sorry that Arthur's network is not great. Could we have Anthony, please, to just chip in?
So basically the challenges we have start with the policies that I was talking about in the beginning. First of all, when you, I want to give example, a biggest example in Uganda we have. There is no nurse in Uganda who will say that he has a medical insurance, that whether you are working for the government, whether you're working for the private, that you don't have an insurance that you will say that is provided by government. When you get sick, you also follow the line with other. When you to meet expenses, you meet them on your own, on that peanut you always get. So you realize that there is no way how you offer quality services when you yourself you are also not privileged to even get the better services you are even giving. For example, I want also to give another example that we have good private hospitals. But when you realize the nurses who are working there, even if they fall sick, they can't manage the bills for that specific hospital. Surely you realize that that gap is a big gap that will lead us to not offer quality services. So what we need to change is nurses and midwives should have privileges as nurses, as the healthcare workers who are on front line or who are offering these services. Then another thing is when we come to the standards of living, you don't expect people to live well when they are paid less. Surely, this is a generation, this is a population that is also surviving with other colleagues. You need to pay school fees for the children. You need also to live a happy life. So those incentives that are basic, for example, offering accommodation for the nurses and midwives at the health facility level, it is key for them to at least have a stable mind, not looking for accommodation yet you are even working for the government. So another thing is still we have, like for us who are in local government, there are challenges that you realize that you are moving a long distance, but there are no incentives that are even offered. You don't even have like a chance that you, after 5 years, after 10 years, you are even given a scholarship to go and study or add on other skills. Those chances are not there. It is you on your own. So it means when you put in your money, still you will need that money to come back. But if you are supported by either organizations or the government itself, at least you realize that you are even motivated to work harder and perform. Then when we talk about the global scene, surely we need collaborations with nurses and midwives. And this is, they should be directed to those healthcare providers who are in the hospitals, health facilities. But when it comes, there is a policy that you first report to the political heads. Yet these people you are reporting to doesn't even know any role you are even supposed to do. They don't even care. For them, what they need is just to satisfy themselves. So basically, we need to create, I'm a member of the Global Health Nurses, but I was also looking at the International Council for Nurses. You realize it is even few nurses who even know about that council and what it even does internationally. And nurses are not even involved in Uganda in that. So even if they are there, they are just few who just try to penetrate and enter that like organization to be funded. For example, research has just come in, but this kind of research, it starts at diploma level and above. Yet we have a biggest percentage of nurses who are enrolled midwives, enrolled nurses. This kind of research, I don't know the policymakers of curriculum, what they were looking at, but if someone is having that younger mind, can grasp everything. Research should start from the beginning, should start from the grassroots, so that at the time someone gets experience of more than 20 years, 10 years, should be able to do research on our own. We even have few nurses who are involved in research, and you realize that it brings us back. You realize that grants are given to medical doctors, it is given to other cadres under there. But for nurses, if you write, they still scrutinize you as this is a nurse, you will not be able to offer the services we need. So it becomes a big gap whereby we are even offering the same quality services, and we are the best people and frontline workers who are looking at these things we really need.
Right.
And the final one is the global collaboration. Some hospitals should even try to collaborate with Ugandan hospitals in a way to help these fellow nurses to benchmark what is happening at the international level, so that they can also build the capacity within the fellow team when they return back. I think those are some of the few key issues that I can highlight by now.
Great. Thank you.
Thanks so much, Vivian.
Thank you. I think, Innocent, you're the last one with this question.
Okay. The point of maybe is like outside bodies, how they can come collaborate with us. One, I'll talk about patriotism amongst these our governing bodies, the bodies that are governing us, amongst those people. I think those people should develop that spirit of patriotism. When I talk about patriotism, I'm meaning the love for the country. These people in our bodies, I think they're just thinking about themselves. So even these bodies, apart from the Nurses Council, maybe even I think the Ministry of Health, you will end up finding out that nurses, they don't know even any other governing bodies that are governing them. So these bodies have not done enough to shape themselves. I think all they do, I think, is all about thinking about themselves, because they have not done anything. They have not done anything for us. They have not done anything to shape. I don't know whether they are not there or they are there and we don't know them. I don't know. So, but you will not tell me that the other people, maybe those organizations from outside, they will just end up coming out when even these bodies have not done enough to implement some structures for those people abroad, for those people outside countries, whereby they can have a starting point too. Because you will not tell me that will just come out from the other end and come here. Because there are organizations which are coming, but the organizations which are coming are not specifically for us nurses, or they are not specifically to come and build challenges we nurses are facing. Are you getting my point? So these bodies have a lot to work. The bodies I'm talking about, the bodies of us, like our bodies within our country, Uganda. So the challenges we are facing, we are not facing them because of the government or what, but we are facing them because of our bodies that are governing us, because they have not done enough for us. You get? So they have to work hard so that the other bodies from abroad, they also have a starting point. And those bodies, I think, should come specifically for nurses, not specifically for other challenges. Because the bodies coming in or the organizations coming in, you will find that mostly for them are patient-centered. They are not nurses-centered. Maybe they will do to come and address their points to you nurses. After addressing, they go on with the patient, but they are not specifically for us what nurses. So those bodies, I think, should come out when they are for us nurses. Those organizations that want to collaborate with us, Uganda, they will have to come to see how we nurses, we find a solution to our challenges. But there is no those organizations will come in. Our bodies here in Uganda haven't yet done anything. So that's all.
Thank you. I mean, this is a great segue to wrap this up, but there's so much that I want to ask, but again, we've run out of time. And the nurses, like you've all said, are the ones who are closer to the people, who understand the problems that both the patients and the hospitals are facing. So, and I mentioned this just in appreciation for what you all do. It doesn't go unnoticed by everyone. It's the reason we have this meeting today. It's driven from the appreciation of the work that you all do. And I hope that this is just going to be the beginning of continuous conversations and who knows, we just keep talking until we get somewhere. Hopefully see some kind of difference in the nurses world, not only in Uganda, but in sub-Saharan Africa, because surprisingly, it's a similar case with some of the countries in sub-Saharan Africa. But with that, I just wanted to say thank you for the time you had today. Thank you for the insights, for the experiences that you've shared. I will put this together, and hopefully our audience can learn about the nurses' experience in Uganda. Of course, I have to put the caveat that this is not a comprehensive experience. It's not a one-size-fits-all. It's not a monolithic voice. There are so many different experiences. Maybe there are the nurses who think everything is okay, but that's okay. Today, it's we are talking about, we're sharing all these experiences. And to our viewers, I hope you have learned about nurses, all their experiences in Uganda, and I hope you can play a role in improving the lives and well-being of nurses in Uganda. But for now, thank you for watching Healthcare Blind Spots. Till next time.